and thank you for staying with us. I'm Cassie Hudson.
I'm Casey Kantz. New York health officials responding today over the new federal guidance for pregnant women regarding a common over-the-counter pain reliever.
The FDA is issuing new recommendations suggesting a possible link between the use of Tylenol during pregnancy and later diagnoses of autism in children.
Our Capitol correspondent Jamie DeLine has more on the debate and also the mixed messages for expectant parents.
New York State Health Commissioner Dr. James McDonald is sharing his response after the federal government said some studies suggest that using acetaminophen during pregnancy may cause neurological effects in children.
Acetaminophen is a medication that's been around for many, many years and really very safe during pregnancy. It's actually the safest over-the-counter medicine for fever or pain for someone who's pregnant.
Acetaminophen is an ingredient in the brand name medicine Tylenol. On Monday, Robert F. Kennedy Jr. made this announcement.
The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen used during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism.
The Federal Drug Administration will begin the process of changing the label for Tylenol and similar medicines. Commissioner McDonald doesn't think that's necessary.
I don't think that you need new labeling for Tylenol. I think, quite frankly, it's going to just confuse people here, because here's the concern. When someone's pregnant and they have a fever, that's an important medical problem. You need to get attention for this. But quite frankly, doctors know how to manage this here, but quite frankly, there's no compelling evidence that Tylenol even introduces any risk here to someone who's pregnant.
Democratic State Assemblyman Angelo Santa Barbara has a son with autism and serves as the chair of the Assembly's Committee on People with Disabilities. He shared a statement saying in part that the, quote, federal announcement reminds us how complex autism is and how urgently families need clarity. While researchers examine possible causes, my focus is on ensuring families have support they can trust. Therapies, educational opportunities, housing, and workforce programs that help individuals reach their fullest potential. Republican Senator Jake Ashby, who serves on the Health Committee, stated, quote, recent years have been rife with controversial and polarizing healthcare discourse from officials on both sides of the aisle in Washington and Albany. My advice is for people to do what I do. Find a doctor you trust, contact them when you have questions, and do what they tell you to do. For anyone wondering how to sort through the messaging of this announcement, Commissioner McDonald reiterated this message.
If you're pregnant, talk to your doctor about your unique medical question, get customized, personalized advice.
Reporting in Albany, I'm Jamie DeLine.